My name is Dr. Kurt Belk, and I'm a board-certified emergency physician and the medical director of the Urgency Room. I want to thank you for choosing us as your healthcare provider. The following video offers follow-up care instructions to your recent visit.
I'm Dr. David Romans, a board-certified emergency physician. During your visit, your healthcare provider diagnosed you or your child with otitis media, which is an infection of the middle ear that occurs most often in young children. Kids tend to get middle ear infections after coming down with an upper respiratory infection or a cold. The eustachian tube in the ear helps equalize air between your throat and ear, and if fluid gets in there when a child is sick, it can become infected. Children between the ages of 6 and 18 months are at the highest risk for developing otitis media because their eustachian tubes aren't fully developed. The tube is in a more horizontal position, so fluid is easily trapped. Otitis media is uncommon in adults since the eustachian tube is at an angle and the fluid can escape down the back of the throat. The infection can be acute, coming on over a period of 1 to 2 days, and can last weeks and even months. That's when a chronic otitis can develop. People with acute otitis might experience pain, tenderness around the ear, fever, diarrhea, or a rash on the stomach. We treat most people with inner ear infection with antibiotics. Depending upon your age, your doctor may also recommend anti-fever medications such as acetaminophen or ibuprofen to help reduce inflammation. If the pain is severe, your doctor might prescribe numbing ear drops that can give mild to moderate pain relief. Once you're home, continue to manage any symptoms you or your child might be feeling. Follow the recommendations made by your doctor. Even if your child is feeling better, finish all of the antibiotics in your prescription. Keep your child well hydrated, monitor their temperature, and make sure they get plenty of rest. Schedule a follow-up visit with your primary care physician to see if the medications were effective and to help you determine if it's necessary for your child to see an ear, nose, and throat specialist. Keep in mind that fluid can be present in the middle ear for several weeks, but that doesn't mean the infection is still there. It can take a while for the body to absorb the fluid or for it to drain out of the eustachian tube. If your child's fever is not getting any better, even with anti-fever medications, or if your child looks ill to you, has persistent vomiting, or has had fewer wet diapers than normal within a 12-hour period, please follow up with your doctor or return to see us.
These videos are intended to provide helpful health information to the general public. They are not intended to be a substitute for professional medical advice. You should not use this information to diagnose or treat health problems, and you should not use these videos in place of a call or visit to a medical professional. Talk with your physician about the proper treatment for your particular condition, and always follow your physician's advice. If you think you need an ambulance or are experiencing a medical emergency, please dial 911 immediately.